Good morning, everybody, and welcome. I'm Bob Greenspan, Chief Executive Officer of the New York Hotel Trades Council and Hotel Association of New York City, Inc. Employee Benefit Funds. It is my honor and privilege to welcome you to this ribbon-cutting event marking the opening of our new Brooklyn Health Center. For 70 years, hotel workers and their families from all walks of life have trusted their care with our health centers. I've often asked what sets us apart from other healthcare systems. How have we been so successful for so long? The answer is complex. It involves our history, our governance, our teamwork, and our longstanding commitment to excellence and innovation. But put simply, I believe it is our staff and their approach to patient-centered care that distinguishes the health centers as best in class and further ensures our further successes. I have been privileged to serve this organization and its membership for more than 40 years. At the health centers, the patient is always first, and I believe all of our employees feel this way, and it shows. You will find that our people take the time to listen and thoroughly understand health issues and concerns. We are committed to providing the best care for every patient, every day. It is our duty and our promise to work together to discover, practice, and teach the medicine of tomorrow. As our country grapples with the problem of an unsustainable rise in healthcare costs, we at the funds are investing in our conviction that our integrated delivery model will continue to be the best healthcare solution for the next generation of unionized hotel workers, and frankly, a model that should be emulated for millions of Americans throughout this country. Our new Brooklyn Health Center supports a new care continuum that focuses on wellness, not just on responding to illness. Our new building is inviting and it is easy to use. It will be a place that our members come to as part of their normal life, not just when something bad happens to them. We are assembled here today to celebrate the opening of the center, but we would never have gotten to this day without the tireless work of many. First, I would like to thank Mr. Dadapandi and Mr. Ward and our entire board of trustees for their unwavering support of the work we do at the funds. I would like to thank my exceptional staff, in particular Harry Veras and Andrea Windsor, Eric Clancy, Tamika Simmons, Louis Ordorno, and my entire senior management team. I'd like to thank the Governor, Borough President, Senator Majority Leader, and other distinguished guests. Your presence here this morning adds immeasurably to our joy and pride in this day. In an increasingly politicized and antagonistic environment, our funds are a shining example of what can be accomplished when labor and management work together. I believe the New York Hotel Trades Council and the Hotel Association of New York City, Inc. can both look with pride at the system they have created and know that not only have they done good work, but that it is perceived as good by our stakeholders, providers, and patients alike. A system of healthcare in which those who give care can boast about their work, and those who receive that care can feel total trust, confidence, and comfort in the care they are receiving. It is now my pleasure to introduce Mr. Vijay Dadapande, President of the Hotel Association of New York City.
Thank you, Doctor. Good morning, everybody. On behalf of the Hotel Association of New York City, it's my distinct pleasure and privilege to welcome you all here this morning. A special thank you to the distinguished elected officials who are here, Governor Cuomo, Public Advocate Tish James, Speaker Melissa Mark-Viverito, and I'm told the Mayor is going to be here shortly as well, and of course, Comptroller Scott Stringer. Your unstinting support for our industry over the years is deeply appreciated by all of us. I'd also like to acknowledge the presence of many industry leaders over here from my industry, some of whom could not be here, but they sent their well wishes. In particular, I'd like to mention Mr. Mahmood Kimji, Dr. Richard Bond, Tyler Morse, and John Fitzpatrick, who I believe is here, as well as senior management from many hotel companies. George Green, Robert Lafferty, I know are here. And my thanks also to the chair of the Hotel Association, Hervé Houdre, who's also the general manager of the Intercontinental Hotel, Barclay. The Brooklyn Health Center represents an unparalleled coming together of labor and management to create innovative solutions that have profoundly positive impacts on our thousands of employees. It's a model that we've taken elsewhere as well, the cooperative model, and has been highly successful. And for that, I need to point out and congratulate the tremendous Mr. Peter Warner's tremendous leadership in this area. I'd also like to give a shout out to Joe Spinato, my predecessor. I know he's somewhere here in the audience. He was there in the formative years of this project and gave fulsomely to it. Last but not least, let me thank the press for covering this momentous event. As Dr. Greenspan just gave you some numbers and statistics, these are really astounding stats, and this is real news, folks. Thank you. Yes. I'm sorry. Mr. Peter Ward, please, President of the Hotel Trades Council.
Thank you. Thank you. Thank you, everybody, for being here today. I know it's hot, and I'm going to try to move as quickly as possible. I'd like to start out by recognizing Dr. Bob Greenspan. Dr. Greenspan's been with us for 40 years. There is nobody in the United States of America who understands and is qualified to deliver health care in this type of a setting than Bob Greenspan. He is by far away the foremost expert in the United States in the delivery of health care in this type of a setting. The design of this building is his dream child, and it's the crowning achievement of a long career with us here at Hotel Trades. Dr. Greenspan is the driving force between what happens here every day on the ground. He sets the tone, he sets the agenda, and he makes sure that the trains run on time and that patients feel like human beings and that hotel workers have a sense of ownership over this facility. So thank you, Bob. Our fund staff employs 1,000 people, doctors, nurses, healthcare professionals, and clerical people and executives. I'd like to name just a couple, and I hope that everybody will understand I can't name everybody. I'd like to recognize Harry Veris, who's our CFO. Harry's done a great job of staying on top of this project. Andrew Windsor, who's one of those guys that you just go to when you have a problem and always seems to find a way to get it fixed. Our medical director of this facility, Dr. Walquist, and my family physician. See you back there, Doc. And Dr. Vincent Jarvis, who's our medical director and who does a great job overseeing our whole facility. The construction team was headed up by Francis Kaufman. I'd like to congratulate them for the design of the building and for working collaboratively with us to get to the point that we are at now. Skanska is the construction company who built it, and the manager day-to-day in the job was Carrie Wetstein, who really did a great job. She just drove the project, stayed on top of it, and got us to where we are. Most importantly, the workers from the building trades that we're here every day, rain or shine, hot or cold, that did the work to dig the hole, lay the foundation, and rise this building up and finish it and turn it into what it is, deserve a tremendous amount of credit, so I'd like to acknowledge them. I'd like to take just one moment of personal privilege and acknowledge my wife, Debbie, and my daughter, Tina, and Nicole, who are somewhere here. How you doing, girls? And I'd like to acknowledge some elected officials. Governor Cuomo was here. Thank you, Governor. We're expecting Mayor de Blasio shortly, and Public Advocate Letitia James is here. Comptroller Scott Stringer. Council Speaker Melissa Mark Viverito. Assembly Member Walter Mosley. Council Member Laurie Cumbo. And Assembly Member Linda Rosenthal. This system is funded by the hotel industry through a collective bargaining agreement with the union. The system has served workers since 1949. I want to thank the industry for their enlightened approach, for their partnership with us to make this happen, and mostly for the literally hundreds of millions of dollars that they pay into this healthcare system to make it work and operate. I'd like to acknowledge VJ Dandapani from the Hotel Association. VJ, thank you for your efforts and your help. There are some members from the association board here I'd like to acknowledge as well. John Fitzpatrick, Hurry Houdre, Robert Lafferty, Joe Spinato, the former head of the Hotel Association and one of the brainchilds of this project, is here with us today, and George Green. Thank you all for being here. And Joe, wherever you are, it was particularly good to see you today. There was just a couple other notables I'd like to mention. One is Vincent Pitta, the union's counsel. And David Rothfeld, who's management's counsel and works collaboratively with us in our combined benefit funds. And from my union, my international union, we have Dee Taylor, and who is our president, and Gwen Mills, who's our secretary treasurer. And then finally, there were just a couple of people I want to make a remark on from HTC. I'd like to acknowledge my friend Jim Donovan, who is here somewhere. There has not been a single project that I've worked on in the union that's been of any consequence in 36 years that Jim was not a part of. I'd also like to acknowledge Rich Morocco, who is our in-house counsel and an invaluable part of our team. And two other extraordinary leaders. One is Vanessa Mead, who kind of makes the... And finally, Julia Ryback, who is in charge of our mobilization and internal organizing. In 1949, it was inconceivable that hotel workers in the city of New York, who were mostly made up of migrants from the Deep South, African Americans fleeing the Jim Crow South, and immigrants mostly from war-torn Europe, working in hotels as maids and dishwashers and cooks and cleaners, should get fringe benefits, should have health care. It was inconceivable that that could happen. The leader of our union at that time engaged with the industry vigorously, and what they came up with was an idea to build a health center. And the concept was provide a low level of health care for as little money as possible to as many people as possible, period. That's how this all got started. As attitudes changed, as times changed, as everybody's view of these things evolved, our operation began to evolve. And so today, we now serve 90,000 lives. We have 33,000 union members, and contributions to this benefit fund are made on their behalf by the Hotel Association. That money provides for them 100% cost-free health care with no out-of-pocket expenses or co-pays. It provides that to all of their dependents and to the member and his spouse upon retirement until death. All of that is done for about 35% cheaper than it costs to buy health care on the open market. And the reason for that is because we own and we operate and we manage everything ourselves. And our operational ethos is that the patient comes first, that primary care is the most important thing, that intervening in a human being's life to help them change behavior so that they have better long-term health care outcomes. That's our operational ethos. And what we've learned, because we have patients in our care for so many years, is that when we concentrate on their health care on the front end, not only do we get better health care outcomes, but we save millions and millions of dollars on catastrophic illnesses. So today I'm very proud to be here This is a very, very important moment for me personally. It's not every day that you get to build a building in your hometown. I know this neighborhood very well. I'm very proud that Brooklyn has had the renaissance it's had, and I'm very proud that we're a part of it. So I once again want to thank everybody for being here, and once again want to give special thanks to Bob Greenspan for his efforts. Thank you. And I'm now going to ask Governor Cuomo to come up and say a few words.
Thank you very much. Thank you very much. I'd like half the amount of applause that Peter Ward was given. Perfect. Exactly half. It's my pleasure to be here today and to acknowledge all the elected officials who are here today. Tish James and Scott Stringer and Melissa Mark Viverito. To Dr. Greenspan, who was 40 years. This is a great vision, and better than a great vision, it's actually implemented. But most of all, to Peter Ward, who really has done something for the ages, for people, and something that will be a great part of the legacy of this union. Let's give Peter Ward a round of applause. Just so you know, this building was my idea. I built this building. I am providing the medical services in the building. I am the full-service governor, I want you to know. I just give Peter the credit. No, this is really extraordinary, and I'm going to be brief. Otherwise, this facility will be very busy with 200 people suffering from heat stroke, and I don't know that they're ready for that. Healthcare in this nation now is a crisis, and you've all watched the news and you've heard the debate, but it's a crisis, and people are trying to decide in Washington what to do about it. What they're really trying to decide, by the way, is not to do what to do about healthcare. It's what to do about healthcare for poor people and for working families and for middle-class families. Make no mistake, the rich are always going to have the best healthcare system in the world, right? That's what we have in this country. The best doctors, the best hospitals, the best talent. What they're trying to decide is, what's the healthcare for the rest of us? And President Obama said, healthcare is a human right, and we should all have healthcare. And what this Congress is saying is, well, if you can pay for it, great. But if you can't pay for it, we don't want to pay for it on your behalf. And that's really the argument that's going on. They want to cut health care funding to states. What would it do to this state? Seniors wouldn't get health care. Disabled veterans wouldn't get health care. Working people would have to pay more for their health care. That's what this discussion is really about. Now, they say that it's been defeated. I don't know that it's been defeated. This initiative is like a snake in the grass. You know, you think it's dead, but sometimes it's just lying there. And you start to move and it jumps up and it bites you. So I think we have to make sure that their health care proposal is dead, because it would decimate 22 million Americans and 3 million Americans in this state. What there hasn't been enough discussion of is, what is the way forward and what is the future, and how do we provide efficient, effective health care to working people in this country. And that's what today is all about, because this is an example of the future. And this is a model that says we can give working people beautiful, quality health care, second to none. Second to none. The Cadillac of health care plans. The facility is beautiful. And we can do it economically and efficiently and effectively. And that's why when Peter talks about doing this for less money than most people are paying for private plans. That is an extraordinary accomplishment. And with all the criticism, this is the first positive sign and positive direction of the way forward that I've seen in a long time. And I would invite Washington to come up here and look at this facility to find out a real solution to this healthcare crisis rather than pointing problems. My last point is this. I know how things get done. And things get done when people come together, when there's a coalition, when there's talented staff. But there always has to be one ingredient. There has to be leadership. And there has to be someone who's willing to take the risk and do the work and has the vision and takes the lead. Nothing happens without that. I don't care what it is. And a project like this, as ambitious and difficult as this is, because it's a lot easier to say to your employees, here's a health card, go to the neighborhood health clinic. This was a function that most unions don't even go near. And it really was about vision. It was really about drive. And there was only one person who could have gotten that done. And it's a person who cares about the workers, cares about the union, cares about their families, and has the drive and the leadership and vision to do something really unique in this nation. And that's my friend Peter Ward. Thank you and God bless you.